Welcome back to the Maven Matriarch Podcast. I'm your host, Bianca Burke. This is the space where we guide women, especially moms, to build within their home, in their business, and most importantly, within themselves. Today's guest is not only a doctor, she is a pioneer. Please welcome Dr. Teresa Irwin. She's a board-certified female pelvic medicine and reconstructive surgeon and president of the Caring Center for Women in New Braunfels, Texas. Dr. Irwin is not only a doctor, she is the only board-certified FPMRS surgeon in the entire San Antonio and Austin corridor. She's one of just 1,500 in the whole country. She trained as a robotic surgery proctor, and she teaches other doctors to master that technology that is really changing women's healthcare. For over a decade, she has given her time as pro bono medical director for Hayes County's Women's Health Program. She built all of this, which is most importantly, she built all of this while raising her 3 sons and building a life with her husband, Dr. Richard Lau. Dr. Irwin believes healthcare is not just about the body, but it is about the whole woman. Mm-hmm. So today she's going to bring that fire for us. Welcome, Dr. Irwin. How are you?
Hello.
Hi.
Thank you for having me, Bianca. I'm honored that you asked me to be on your podcast.
I am honored to have you. Thank you so much for taking the time. I know the life of a surgeon is busy, busy, busy. And the fact that you came on here to speak to my audience and inform us more about what you do, it will truly help them. So I want to start by asking you an important question. What made you choose this specialty? Because I know you are a nurse and then you went to medical school. What made you choose this? So tell me a little bit about that journey.
Well, so ever since I was 5 years old, I wanted to become a doctor. But once I got into high school, I'm like, what the heck does doctor mean? What is it to be a doctor? And because I didn't know anybody, I hadn't been exposed to anybody in the medical field, I just had to go on to nursing school. I thought, what a better way to learn about it. And if I decided I did not want to choose that path, then I had a wonderful career to fall back on. And it just really made my desire to become a physician even greater. And interestingly, I wanted to become an interventional cardiologist because I worked as a coronary care unit nurse.
Okay.
And as I went through my rotation in internal medicine, and they said, you have to do 3 years of this. I thought, no way. No one can do that. And then I also said I did not want to go into psychiatry because I had very poor experience in my nursing school. So I ended up going into gynecology. So it ended up being a little of psychiatry and then the gynecologic component that I do mostly now.
Yeah.
So I thought as I went through internal medicine, decided that was not for me, and I went through with the surgery rotation. I thought I definitely want to be a surgeon.
Yeah.
And then obstetrics followed it. And going into OBGYN, you have a wonderful world where you're bringing new life into the world.
Okay.
First person that gets to hold a new life. What an incredible feeling that is. I can be in different places. I can be in the operating room, my clinic, in the the delivery room.
Mm-hmm.
A lot of variety. And I got to be amongst a lot of mostly happy women. So it's that's kind of how the journey started. And now where I'm at now is interesting because Bianca, I've come full circle. I started doing deliveries, general OBGYN, and that's where all injury starts. And now circling, I'm fixing it.
Yeah. Yeah. But you have to know all of that to be able to fix it, right? So it makes sense. Okay.
Yeah.
And that's an interesting journey. And being a mom on top of that, right? How was that for you during all this time?
Well, Bianca, I'm very fortunate because I practice in a small town, small hospital, and usually there was just one OB-GYN on call.
Yeah.
And so therefore, I had the call room to myself. And when our oldest son became 5 years old, I started to bring him into the hospital with me. He'd spend the night there with me. And as each one turned 5, I would bring them to the hospital with me. And many fond memories. But after a while, there was 3 boys, and all he had was a twin bed to sleep. Guess where I was? On the floor. So I just
Of course.
I had to put them on a call rotation. And interesting story. Our middle son, one day, he comes to the bath to our bedroom, and he's got tears welling down his cheeks, and he's like, "Mommy, why is it that every time I'm on call, we don't get called in?" And I said, "Me,
Mhm.
I just got a phone call from the nurse, and we have a patient in labor. Go get your call bag and let's go in." Of course, that was the truth.
Your little doctor.
So we went in, and from that point on, I vowed that I would always take one of the boys with me to the
Yeah.
hospital. And they loved going because they have to do 3 things that they don't usually get to do at home: stay up late,
Mhm.
watch TV, and eat from the vending machine.
There you go.
Nurses loved it too. They,
Yeah.
call room was right next to the nurses station. So it was a beautiful thing that I was able to do that. I mean, how many people can say they did that with being a doctor? Uh,
Right.
we're very fortunate that I had that opportunity. But as they got older, when our oldest became 13, my husband and I decided that I would stop doing OB so I could be more at home and available for all their games and activities, et cetera, et cetera. So that's when I stopped doing OB and focused, became subspecialized in pelvic surgery and reconstructive um, pelvic medicine, reconstructive surgery. They've named it a new name. It's called ERPS. It used to
Mhm.
be
Oh, okay.
female pelvic medicine reconstructive surgery, but now it has changed. I don't know why they keep changing it. It doesn't make any sense. It'd be much easier.
Maybe they're making it shorter. I don't, it sounds shorter.
But the easiest one is urogynecology, the original term.
Euro.
Anyway,
Yes, I saw that. I saw that name. Um, I want to go back to the point where you had to shift, right? It's as a mom, and this is what we do here. We focus on the shift that we have to make in our careers, right, to be present for our family. And so I thought that was really, that's something that's important to address, that you and your husband decided, like, hey, you need to be more present. So how can you do that with maintaining your career? You had to make that switch. And
right.
it worked out well for you, which is great because you continued forward. But it's so important for women to know that there's always a way, right? There's always a way to have both.
Mm,
um so I want to go into a little bit of what you do, because postpartum bodies, right? They go through so much, right? And then not a lot of women have heard of FPMRS, well, as I have it here, but there's other names for it. But they don't know about the issues. They may have the issues, but don't know where to go to seek help. Because yeah, they just don't know. So nobody prepares us for this after birth. So what do you wish that every mom knew about their pelvic floor after having kids? This is a woman listening who may have these issues. What would you tell her?
Well, first of all, let me give you a few stats.
Okay.
And I just looked this up yesterday because I used to quote that over 50% of women will have urinary incontinence at some point of their lives. It's now 63%.
Wow.
And 25% of women will end up having surgery to fix their prolapse, meaning where the pelvic organs start to descend
Yeah.
and sometimes even come out of the vagina.
Yeah.
And those are ginormous numbers, Bianca. I mean, it's an incredible problem. And granted, not everyone has severe levels of these,
Mm,
but there's still bothersome symptoms and they're embarrassing and they affect their quality of life.
they are.
So in 2020, our oldest son and his girlfriend helped me develop my social media platform so that I
Okay.
can get that education out. So I
Yeah.
talk very much because I mean, there's so few of us across the nation to correct these problems. And I'd like to be able to help women not reach to the point me or another colleague.
Right.
So our platform was developed to teach a lot of the little things. So for example, how to do pelvic floor exercises correctly, because most of us don't know how to do it. Your doctor may say, hey, do Kegels. Well, what does that
Right.
mean?
Right.
Um, and I'll be the first to admit that I didn't know how to do them correctly until I really got into my subspecialty. Also, how to sit on the toilet to pee versus to poop.
Mm.
Different ways
Mm.
to do it to be more effective and to reduce your risk of prolapse and bladder. retention, and all sorts of issues that I treat. Also, believe it or not, how to drink your water correctly. There is a correct way to do that.
Really?
Yeah. How to prevent constipation. Because that, all that pressure, if you're constantly bearing down, you're
Yeah.
causing risk of prolapse. Additionally, what's more irritating to the bladder and your bowel system. Certain foods and beverages will be worse for both of those areas. Some are different for one than the other. And just so many things that are so critical, and they're simple.
Yeah, and I did not know most of those. I did not know about the drinking water. And as a mom myself, I have a 2.5-year-old,
Oh,
and I saw. I mean, it's like you said, it's embarrassing, right? But every time I sneeze or
mhm,
laugh too hard or cough, I'm like, ah.
yeah,
I have to go. I have to go change, or like, it's very embarrassing. It's not something that people want to talk about. But we all are suffering from some level
yeah,
of that.
yeah,
So it's important that you do give some awareness, show some awareness to these issues, and that women have a resource and they have somewhere to go. If it's not in their region, then they can seek someone online, right?
mhm.
Um, so
And a very important person, Bianca, that I want to mention is the
mhm.
pelvic floor therapist, and
Okay.
they're the ones that really spend all the time teaching you these things. I kind of feel like an imposter online because all the things that I say are based upon what the pelvic floor
From
therapist.
them. Yeah, yeah.
Yeah. Um, so, even if you don't get to a physician, simply seeing someone like that is really beneficial, and starting early,
Yeah.
in the early postpartum period is a great time to start it. Before
Yeah.
pregnancy is a great time to start it. That's actually, I started on TikTok
That's
first.
great.
The fact that the population is younger, because I wanted to hit young women, because that's when you want to really start to attack it. And prevention goes, uh, quite a distance in comparison to treatment.
Right.
If you get to the point where prevention or these supportive measures aren't good enough, there's certainly great things that are out there for you. So, for example, you talked about stress incontinence, and I personally had this procedure done about a year ago, and it's a bulking procedure of the urethra. So we actually inject a filler around the
Oh,
urethra, so it reduces the diameter. So when you cough, sneeze, jump, laugh, lift, exercise, or have sex, there's not leakage of urine. And mine was mild. And I wanted to attack it early
yeah.
with a very simple procedure that has no downtime. In other words, you can go back to work, go back to exercising, having sex the very next day.
That's great. Yeah.
And because it's a filler, of course, it's temporary, but you have to have it redone in
Keep
about
going.
2 to 7 years. But that's not that often.
No, it's better than dealing with it every day, right?
Mm-hmm.
So, but I love that. I love targeting women, younger women who are maybe have not had children, thinking about having children, or have their first child, because, like you said, prevention is better than treatment, right?
Hmm.
The reconstructive surgery is probably the last
Right.
stitch effort to kind of fix. But if you can build those muscles, like with Kegels or the pelvic floor exercises in advance, then they have a better chance of, remaining healthy throughout
Yeah.
the time there. Yeah.
Right.
Okay. That's super important.
Yeah.
Um, and so I want to get back to work and motherhood, right? Career and motherhood. You built your career while you're raising your family, you're raising your sons. What did motherhood during that time teach you that medical school never could teach you? What did motherhood teach you? Exactly.
Well, it teaches you priorities, right?
Mm,
And medical school, unfortunately, it's a grind, and it teaches you that that is your primary and only focus.
yeah.
And yes, of course, you have to put in the work, and you have to learn it. You have to do it well, and you have to make sure the patient is safest and being treated the best, of course. However, you can have children, and
Mm,
when you do have children, it really does change your perspective. That does
absolutely.
priority. Maybe I can't be there all of the time, but I will find ways that I can be there at important times. And I mentioned some of the ways that I have done it.
Yeah.
You can tailor. I was just talking to, I have a student PA in surgery with me,
Mhm.
And she decided not to go to medical school because she did not want to give up being a mother. And she was afraid that if she did go on to medical school, that she would have to give up a lot. And I,
Yeah.
there may be a period of time where you do have to give some of that up, but you can still do it, and you can
Yeah.
tailor your career multiple ways. It's a lot. It's a lot easier now than it was in the past, in the good
Mhm.
old days.
Mhm.
Is where it has to be this, this, and this, and no deviation. You can work part time. But again, uh, in terms of motherhood, just simply having the kids just changes your perspective, and you realize what is most important. And I always wanted to be a mother. There was no question there. The
Yeah.
question was timing when I would have a child. Interestingly, Bianca, uh, when we're about to get married, um, we I got off birth control, and
Mhm.
on our honeymoon, my breasts were killing me. I was like, "Oh, this must be great
Uh-oh.
sex."
Yeah, yeah, yeah.
Well, I was pregnant.
Yeah.
I was
Oh, you
three
were
three.
on birth control?
No, I
Oh,
had stopped it for a month.
stopped it. Okay, okay.
But anyway, the breast tenderness was the pregnancy.
Oh, wow. So see? So,
Well,
but
you just want to always plan things, and
exactly.
you think being a gynecologist, I knew how that would happen, right? And so 2 out of my 3 pregnancies were unplanned, so don't come to me for birth control.
It's not my specialty.
Anyway, but yes, and it's such a wonderful feeling to, um, like the movement during the pregnancy is beautiful. Of course, depending on how hard your labor and delivery was, that can be beautiful. I had epidurals, so I cheated.
Yeah, I did too. So, I'm right there with you. I
And
had the most zen birth. Like it was perfect. It was perfect. I wouldn't change anything.
great. I mean, medications are there for a reason if you want them, of course.
Right.
Um, and then just every age level, every stage, I should say,
Yeah.
of our son's lives has been so fun for different reasons. Like now, all our boys are grown up; they're all engineers. One of them has a
Oh,
daughter,
wow.
and I'm loving this stage too. I wish they never left the house, but that was
Yeah. Oh, it's like you do and you don't, but I know it's like nice having your kids all with you, you know? So
yeah.
it's a blessing. But you should be so proud. Very, successful kids. You have your granddaughter. Congratulations.
Yeah, finally.
That's amazing. And you're enjoying it. That I love that you said that, each stage, no matter how difficult it was, because I know med school is not easy. I know, balancing isn't easy.
Mhm.
But each stage you took the best from it and you enjoyed it. And that's the most important thing.
Yeah,
So that is beautiful.
yeah.
So I'm sorry, go ahead, sweetheart.
I was just agreeing with you.
Yes, yes. I had to take a pause for a second to really be grateful and sit in that. Um, so if a woman is dealing with a health issue, right? And we talked about the embarrassment of especially an issue like this. If she's too embarrassed to bring it up, even with her doctor,
Mhm.
what would you say to her? How would she deal with that?
Go online, look up
Yeah.
whatever it is, the problem that she's having. For example, she's having to pee every 30 minutes to an hour or something. Look up urinary frequency. What do I do about it?
Yeah.
Now with AI, you can find all sorts of
All
answers, or you
that.
can go and follow me on social media.
There we go. That was going to be my closing statement was to tell our listeners where can they find you and where can they learn more about what you do, more about pelvic floor, the exercises, therapists, all of that. Where can they find you?
So on TikTok, I'm Dr. Teresa Irwin,
Thank
and
you.
Instagram, it's the Vaginacologist, and I'll come back to
Love
that.
that.
And the Facebook is also Dr. Teresa Irwin, YouTube as well.
Okay.
So the Vaginacologist, I trademarked that.
I love it. I saw that and I was like, that's cool. I like that.
So the way
Gynecologist.
that came about is when our oldest son, he's 27, when he was in high school, He was talking with a group of friends and they're all talking about their families. And one guy says, "Hey, dude, what is it that your mom does for a living?" And he hears me talk about vaginas all day long.
Yeah.
He's 15, 16 years old, right?
Yeah.
So Bianca, he's like, vaginecology?
Oh, there you go. Yeah, I love it. I think that's an awesome story behind that name, and it fits, right? And so Dr. Irwin, I really want to thank you. I want to thank you for showing us that, what it looks like to be, I'll say, a dangerous woman in your own field, right? You're at the top of your field, and you are a mom doing it. You are the example, right? You didn't wait for permission. You became an expert in your field, and you never stopped showing up for the woman that needed you and for your family. So I appreciate your time today. And then to every woman that's listening or watching, right? Um, I want this to be a reminder for you. You don't have to choose between motherhood and mastery or between motherhood and ambition. You can build both. And this is what this space is for. And if today's conversation really stirred something within you, as a stay at home mom myself, if you are a stay at home mom and you're ready to move towards what's next for you, come and find your people inside my community. It is called the Maven Circle. It is a community that is built as a village. This is the village that we don't have anymore, right? It's here. And we turn, what motherhood builds in us into something that the world cannot ignore. So until next time, I will see you then.